Public Health Minister Dr. George Norton has said that the requisition for medication for hinterland and outlying areas will be addressed.
Much more important is for us to have a system where we recognize that one, our stock is becoming depleted, and secondly, the shelf life of the medication that we have on hand. So it is somewhat of not a simple situation.
Dr. Norton said that there is need for more involvement. This will include contracting out delivery of medication for fast and more effective supply to outlying areas.
You need much more than pharmacists to be involved in this system. You need proper trained administrators. And if we can't do it at the level of the Ministry of Health, then we might even have to evaluate the chances of the possibility of contracting these distribution of these medications out.
The Public Health Minister reiterated the need for a new system of distribution of medication.
We heard of situations where if you're supposed to be given one malaria tablet 2 times a day for say 3 days and you're short, then what the medics did was divide it in half, and these situations like that exist.
He pointed out that the setting up of new systems will not be overnight.
It's not an easy, I'm not making excuses, but I'm saying it's not as easy as it might seem. For instance, to get the medication to Camarang, you've got to send it up to Bartico, which is the regional center. And then Bartico will then send it down to Georgetown so that it could get to Camarang by plane. We're talking about weeks.
Dr. Norton said that in the Region 8 area of Kawana, where there is no transportation, the community health workers usually walk 2 days to and from Keto or to Paramakatoy to uplift vaccines.
Unless you put the infrastructure in place, and Mr. Granger has been saying it, we've got to get our roads, we just can't think about getting into Region 8 as a safari, which is what has been happening over the years. We've got to put roads where bulk items can be easily made to go into these areas.
The health minister noted that it is difficult and expensive to get medication from Siparuta in the quarantine to the community of Barometer in Region 1. He noted that the bond at Madi is not functioning and that he will be working to have the medical storage bonds in the various hinterland districts functioning for the storage of medication. For Prime News, Nicole Telford.